Welcome, everyone, back to the Preventive Medicine Podcast. This is the podcast for all things related to preventive medicine. And like I've talked about in pretty much every episode, we are here to talk about it from every lens, every approach, pretty much everything that relates to preventive medicine. It's not just diet, exercise, and those kinds of things. And today's episode definitely dives into some of the more unique aspects of preventive medicine, coming at it from a systems and kind of political perspective. People say you should keep healthcare and political views separate, but you really can't, in my opinion, because politics, healthcare, and all that kind of stuff is kind of tied into each other when it comes to legislation and all those kinds of things. So you can't really avoid that topic. And today's guest is someone who's actually running for Congress. So he is getting himself well acquainted with all these things, with how politics works and with how kind of everything runs and kind of that integration. But he's also a physician. So he definitely has a unique perspective. Today's guest is Dr. Darren McAuley. He's currently the founding chair for the Department of Osteopathic Medicine at the Orlando College of Osteopathic Medicine. He has incredible, unique perspective. He's actually done 24 years of military service, probably more. He can correct me if there's been more already. In the Air National Guard, he's been the air flight surgeon with deployments to Baghdad and Iraq. And he's also currently the state air surgeon for the state of Florida. He's coordinated medical responses for things like hurricanes in Tampa, and he's currently running for Congress as a Democrat in Florida's 15th district. Welcome to the show, Dr. McAuley.
Thank you. Thanks for having me, Rigal.
And before we get into this intro, which I'll press just in a sec, if you guys are interested in this podcast right now and want to learn more about him, go check out his Instagram and kind of all of his social media stuff for running. It's at Darren4FL. So it's DARREN 4FORFL. So go check him out and let's get into this intro. Overcoming saber-toothed tigers and woolly mammoths, we must now face a new enemy, ourselves. With the rates of diseases such as heart disease, stroke, diabetes, depression, and many others ballooning, we must find a better solution to these modern epidemics. Welcome to the Preventive Medicine Podcast. We believe in building a foundation of health by means of prevention so that you can build the life you want and find fulfillment with no barriers. Hear from experts around the country on how to take your health into your hands. Take control and build a foundation of health for the life that you want to live. And now, here's your host, Raghav Sharma. We hope you enjoyed the show, and if you do, please don't hesitate to subscribe and like for all of our future content. All right, let's get into this. Dr. McAuley, welcome to the show. I'm so excited to have you here.
Thank you. It's great to be here.
You know, I've been looking for someone who's kind of somewhat on the political spectrum for this to talk about healthcare for a while. And it's been difficult because there's a lot going on. So one of your colleagues reached out to me and was like, wow, this is perfect. So today we're going to dive into some interesting stuff. But the first question always is, what does preventive medicine mean to you? That's kind of what I start off every show with.
Preventative medicine to me is making sure that people can live their happiest, healthiest lives. In our healthcare system, we spend so much money towards the end of life, really those last few years. And then as you look at like the last few months, days, the costs just exponentially go up. As a healthcare system, if we were to actually spend that money and put our efforts into giving folks preventative care 5, 10, 15, 20 years earlier, not only would people live healthy, happier lives, but we would spend less money. So I think, we talk about preventative medicine and people think it's, things like taking vitamins and exercise and getting good sleep hygiene. And of course, all of those things are important. But from a systems-based perspective, preventative medicine really is putting in all your efforts where you're going to get the best bang for your buck to get the best outcomes and allow people to be healthier longer.
And I want to echo that systems perspective. For those listeners who've been here for a while, I harp on systems for preventive medicine as being incredibly important. And Dr. McAuley, you've taken a fairly interesting journey throughout medicine to kind of come to where you are. So first, obviously, I gave a brief intro, but tell our listeners a little bit about kind of your medical journey, how you came to be where you're at, and how did you decide to run for Congress?
I started off as an osteopathic medical student at the University of Medicine and Dentistry of New Jersey School of Osteopathic Medicine. And during my second year of medical school, I was recruited to join the National Guard, the Air National Guard in particular, by the dean of my school. And that was, a pretty interesting interaction. You can imagine that as a second year medical student, when the dean of your school comes up to you and offers you an opportunity, you definitely listen to him, right? And he said something that was really weird and kind of quirky, like, do you guys want to serve your country? It was myself and my 3 roommates at the time were at the gym. And two of my friends immediately were like, nope. They kind of knew where he was going, knew what he was talking about, and they noped out immediately. But myself and one of my other good friends really wanted to listen and see what he had to offer. I remembered that, my grandfather was in World War II. He served in active duty Army and then went on to the the Army National Guard. And then both of my uncles who were in Vietnam were active duty, one in the Air Force and one in the Army. And I thought to myself, this would be a great way to give back to my country, get to go places that I'd never be able to go otherwise, and practice a brand and branch of medicine and aviation medicine and in military medicine that most doctors don't get to do. Started my medical career really as a medical student in the Air National Guard. I was able to see patients, and of course, I had to, report back to my attending physicians at the time. But I was able, just as a third and fourth year student, to do procedures and really lean forward in my training, and it made me a much better physician. Over the last 26 years, I'm still in the Guard. I went from first lieutenant all the way up to full colonel. I'm now the highest ranking physician in the Florida Air National Guard, the state air surgeon, where, like you said, I basically coordinate our medical operations for the state. I did a 2-year residency in osteopathic manual medicine, always had a love for osteopathic manual medicine, consider myself a child of still, which is in part why my take on preventative medicine is a bit special, right? So Dr. Still always told us that any fool can find disease. It's the role of the osteopath to find health. And if you look at preventative medicine from a systems-based perspective, with that in the back of your mind, you're always looking for how can I find health for the most number of people for the longest period of time for the least amount of money. And then after my OMM residency, I did a sports medicine fellowship. And my first job out of fellowship was being a professor at the Philadelphia College of Osteopathic Medicine. I went back to be an assistant professor in the OMM department there for just shy of 10 years. My first daughter was born around that time, and I remember coming home. She was about a month old, maybe 3 weeks old. I had come back from PCOM. It was 7, 8 o'clock at night, which is typical for some areas of the country and academia. And I could hear the baby screaming before I even put my key in the door. So I came home. I opened the door. My wife looked at me. She was exhausted. She'd been with this crying infant all day. She handed me the infant and just turned around and walked upstairs. I think she might have mouthed, "I love you," or blew me a kiss. But what I remember thinking while I'm holding this screaming baby in my hand is, I have to find a job where I don't come home at 8 o'clock at night. So I started looking for federal or state employment. I've always had an affinity for veterans, being a veteran myself, deployed all over the world, Iraq twice, Baghdad, Africa, Syria, Turkey, really all over the Middle East and all over the Europe, in addition to Asia. So I said, hey, what if I go to work at the VA? So I started looking for VAs to work at, and I found a VA in Florida, and that's what brought me to the Sunshine State.
That's beautiful. That's quite the journey that you took there. As far as kind of the things that you've learned along the way, what was the transition like from kind of working at like a East Coast PCOM type situation, going back to the VA? What was the biggest shift for you as far as kind of healthcare systems goes, now that we were talking about the system?
I think it was culture more than anything else. It was my first time working for a federal system. And one of the things that I loved most about the VA, which really changed the way I looked at medicine, is that at Veterans Administration, the Veterans Health Administration in particular, we provide world-class healthcare to people who would not otherwise be able to afford it. And you don't really think about the fact that what folks can afford and the amount of coverage that they have, how it affects your healthcare. Because as a physician, you have to work within these different tiers, what an insurance company will allow you to do, what hoops you have to jump through before they'll allow you to give a certain treatment or a certain medication. And you just get used to doing that. It becomes, the standard course of operations. Oh, I'm going to have to try this medication before I can try a more expensive medication. I'm going to have to send the patient to physical therapy for 4 to 6 weeks before I can get them to see a specialist or before I can get them a surgical consult. But when you get to the VA, now granted, they do have different metrics because, they also are cost conscious, but that class of the insurance company and the middleman being on top of you and stopping you from making what you think is the best decision for your patient immediately is gone. And it really was liberating. Patients would come to me who hadn't even seen their primary care physician for pain. Now, in some respects, as a specialist, I was diagnosing things that I definitely think that a primary care doctor could diagnose and treat. But the other side of it is folks' wait time for care, their wait time for an invasive procedure like a hip injection or a shoulder injection was dramatically shortened. And patients really understood that. They understood that they were getting great care. They understood that their copays were minimal. They didn't have that financial pressure that so many people do when they go to see the doctor in the United States of America. That's one of the best things about working at the VA. As a veteran myself, I enjoyed the culture, working with veterans, being mission oriented with other VA employees. And I also got a chance, as an Air Force veteran, to learn about all the other services. I learned more about the Marine Corps and Coast Guard and then the Army in the VA than I had in any other point in my military career. But I would say as a physician, being unleashed to just provide care without having to worry about dealing with insurance companies in between you and your patient was really liberating.
I will say, as a resident, doing rotations at the VA was liberating. Where a patient, let's say they needed a hip injection in clinic, you don't really have to worry about, hey, I need to get authorization for this. Let's schedule you back in like 2 weeks after we get authorization from your insurance company. You're like, hey, you need a hip? We got time? Let's do it right now. And then it's not really that big of a deal, and you don't have to do the hassle of patients back and forth. Your journey obviously became political at some point. What did that jump look like? What made you take that jump? What made you decide to run for Congress?
Well, it was really being at the VA as a physician. I was there for that first round of Doge cuts when folks started getting fired. And I noticed not only did it have a demoralizing effect on employees, federal employees, people that I've worked with for years, really were patriots trying to help their country by helping the Veterans Health Administration and by helping veterans themselves. Somehow, federal government employees and federal government workers were getting vilified. We were being made out to be, purveyors of some type of fraud, waste, and abuse, instead of people actually understanding that these are your neighbors, these are medical professionals, some of whom could be making more in a civilian practice, but they're working for the federal government because they really enjoy taking care of veterans. And then I also noticed the direct impact that it had on my patient's care. So, a new patient internal medicine visit at the Bay Pines VA where I worked was extended from like a month to almost 10 weeks. Currently at the Tampa VA, it takes 140 days for a new patient mental health visit. And when you put that in context of the fact that the leading cause of death for a veteran under the age of 40 is suicide, it's unconscionable that you would have somebody wait 145 days once they finally reach out for help. So I recognize that those changes weren't just happening at the VAs that I worked at. They weren't just happening in Florida. They were happening at VAs all around the country. Mm-hmm. And then a step back from that, it wasn't just happening at the VA. It was happening at the CDC and Social Security and every other federal agency, FEMA. So I really decided, now's the time to display some leadership, try to step up and right the ship and make sure that we can provide services for the American people up to and including healthcare for folks and, of course, veteran services for our veterans. So I decided to run for Congress.
That's very noble of you. Obviously, you can tell you have a deep love for the country and a deep sense of kind of wanting to give back and kind of make this a better place for the rest of us. So thank you for that. It's very, very brave among other people. You obviously decided to get into politics, make things political for yourself, but healthcare has people have not really thought of healthcare super political until more or less recently, until like the ACA and things like that. But in your eyes, obviously you've been around a lot longer than I have. I still have nice black hair, although I found my first white the last week. When did healthcare get so political? How have you seen that change in your kind of time as a physician about the political landscape of healthcare?
Well, I think healthcare has always been political. These are somewhat inherently political decisions. Who makes money and who pays for services, who has to wait and who doesn't, who gets first tier, who gets second tier. I mean, literally, healthcare is about who lives and who dies, right? And those are, when you're fighting for resources and trying to make sure that resources get spent in an area where a given politician is, there's always an inertia and a pull towards things that are political. But what I think has changed most recently is that it's not just political, it's partisan. There are some things that both sides of the aisle used to be able to agree on. For instance, where I worked at the VA, both Republicans and Democrats would be steadfast in saying that veterans deserved health care, that veterans deserve disability benefits. But now all of a sudden you hear people saying, well, veterans deserve it, but there's fraud, waste, and abuse in the VA, and we have to root it out in order to save money. When everybody who works for the federal government knows that, of course, there's always going to be things that we can do to streamline the provision of government services. But vilifying federal employees and poking holes in the agency to the point where it can't function to provide for our veterans would never have been a partisan issue not too many years ago. Unfortunately, we've seen the Republican Party, as it sways more and more to the right underneath the current executive, look for areas where they can find money, right? So the OBBA, I call it the Only Billionaires Benefit Act. I refuse to call it by its other name. Requires that they find money in order to fund some of these permanent tax cuts for billionaires. And in order to do that, to fund these tax giveaways, they realized that they could get money out of the healthcare system, whether that's cutting Medicaid, stopping the expansion of Medicare, becoming an obstacle to the provision of ACA subsidies, and even things like I said, providing VA care. So because of that pull, it's become more partisan, where you have the two sides fighting against one another. And partisanship is inherently bad for teamwork and bad for progress, right? Because it stops folks from working together. So the American people are in the middle of the far right and the far left, demanding that folks work together so that they can have health care. But the two partisan teams aren't really able to form a cohesive network where they can get things done. And I think that is what we've seen currently begin to flourish. And it's going to take, this kind of bipartisan teamwork in order to, meet in the middle and fill that divide.
Two comments on partisanship. We're recording this at a time where obviously there's been the call it a murder of an ICU nurse from the VA system. So there's a little bit more partisan fire as far as that goes from that front. And then also, if we're looking for kind of fraud, waste, and abuse, there's tons of it in the private system as far as extracting profits and reducing the amount of care that people get. We were talking a little bit about prior auths and kind of getting authorization for procedures that are often denied, things like that. It's just fraud, waste, and abuse everywhere. And I was at the VA as well when a lot of those attending physicians were kind of noticing some of those cuts. There was layoffs, all those kinds of things. Partisanship has definitely kind of taken a toll more recently, as you've just noted on that. As kind of healthcare progresses on this, obviously you have your views on kind of what you think healthcare should look like. What are those views, number one? And what is your take on kind of the biggest thing that you mentioned, different kind of spectrums on what it should look like, partisan or not? Medicare for all is the biggest thing. So kind of what are your views on healthcare as kind of a systems-based? And then how are you going to kind of contribute to that, I guess?
Well, I think my overarching view as an osteopathic physician is that we want to seek health. We don't want to just treat people when they get sick, right? So that means, your regular preventive medicine visits in terms of things like vaccines. It means counseling for folks so that they know that proper diet, exercise, and sleep hygiene are going to increase their longevity, going to boost their systems. It means that going to a family medicine visit for a checkup, to find out that you have high blood pressure, or that you have high cholesterol before it's begun to take a toll on your cardiovascular system. Those things will make the provision of healthcare much easier, but also, like I said, much cheaper over time. Currently, what we're doing is we're kind of waiting for folks to break down. And then once they break down, we try to put a solve on it. But instead of waiting for them to break down, they would have happier, healthy lives if we provided that type of preventative, regular maintenance care, no matter what moniker you want to ascribe to it, throughout the course of people's lives. As a physician, I would love to see affordable access to care be the norm for folks, not something that is a pie in the sky that we're all kind of thinking about and hoping for. But I think that what that's going to mean as a politician is that I have to undertake this almost education campaign with the American people. People often talk about how they need coverage. I need healthcare coverage. I have to make sure my family has healthcare coverage. And when I really sit down and talk to them, I say, you don't need coverage. Nobody needs healthcare coverage. What you need is the ability to go to a doctor or a healthcare professional when you need one. That's different than needing coverage. You can kind of see the shift in their mindset. Well, why is it that I think I need coverage? And they don't really realize that there is a tremendous machine that is built around lobbying to make sure that folks really think about insurance as the only way to actually get health care. There's a tremendous lobbying machine that's built around tearing down politicians and proposals that act as if they want to provide health care to all people. And I think that once you get folks to understand that competition and a free market is going to allow for the cheaper provision of care for the most number of people, the American people will be behind making sure that that happens. Unfortunately, when you mention Medicare for all, a lot of people immediately think, oh, that's socialist, that's anti-American, that's not part of the American fabric, that's not what, that's anti-American. And it's really going to be an education campaign to make people understand that you can have healthcare that you provide to almost everybody, right? Without having it be completely government run. The competition between the government and private insurances, private agencies, if people choose to go that route, will lower the cost for everybody over time. I think price transparency is important. It's ridiculous that, some hospitals or some providers will charge X, and then some will charge 2 times X for the same service, same procedure, or same medication. And I do think that we need to have a strongly supported public option so that nobody falls through the cracks and that they can have health care. But if folks, have the money and they want to have their own private insurance as well, they want to have their own employer-based insurance as well, they want to have kind of a boutique or concierge healthcare, then go ahead. I think they should be able to have that. The two systems working in tandem with one another will once again foster that competition, which is the bedrock of capitalism.
Yeah, I think the challenge also becomes in the players that are kind of trying to get financial money out of this, as far as seeing patients, like big hospital systems that are trying to get the best insurance contracts out there. They don't want to see these public contracts from Medicare and Medicaid because they have a standardized set low price compared to what commercial insurances will pay. So there's a lot of kind of players on this. From your perspective, here comes the tough question. As kind of someone who, let's say you get elected to Congress, what can you actually do as far as this goes? Because it's not like you can just say, hey, this is my idea, we're doing it now, go on, which would be great because you have great ideas. But what does your actionable thing like actually look like?
So actionably, and I think that we often underplay this, it's the use of the bully pulpit. I'm not being facetious when I say a campaign to educate Americans. When the American people clamor for something, politicians eventually have to cave in and give it to them. We've seen throughout time that when folks get worried that the folks in their district are demanding something and they're not getting it from a congressperson, but folks in their state are demanding it and they're not getting it from their senator, that forces those politicians to act. So I think the number one thing that you can do when you have a platform is use it to make it clear to people that the healthcare system is broken and why it's broken. It's broken, as you stated, not just because it's so large and bloated, but because there are so many people in the middle, in between the doctor and the patient, making money. Pharmaceutical companies who are charging Americans more, much more, multitudes more, for the same drug that they would sell in Europe and other areas of the world. Insurance companies who have created their own cottage industry of rejecting claims and denying services, even if it has an adverse effect on people's health care. So that doctors and hospitals have to hire billers and coders. They have to hire people just to fight with insurance companies to get their pay. All of that extra drag on the system leads to a lack of the provision of proper care for people. And the average American doesn't know that. The average American thinks that a healthcare insurance company is there to make sure that they have health care. And that's not true at all, right? An insurance company is there to make money for its stockholders. Making that clear to people so that they start to view the obstacles in between them and their doctor as something that's removable is the first step to actually being able to win a legislative battle to change healthcare. Like I said, in the meantime, some of the ways that we get there are price transparency. I am a full proponent of price transparency. Capitalism works when people have different options. And if you're selling widgets at $10 and somebody else is selling the same widget at $8, you just went out of business. Okay. So price transparency is key. Making sure that federal programs like Medicare can negotiate for drug costs, can negotiate for services. That way they can bring the prices down. And as they bring prices down, once again, that filters throughout the rest of the system. Those are concrete things that I think we can legislatively push forward as almost like a stopgap measure in the meantime. And then at the same time, concurrently in parallel, it's up to those of us who especially are physicians and who are in politics, who have the platform to be able to actually explain to people why the healthcare system is broken and what we can do about it.
I want to bring partisanship back into this. I think that's where education becomes difficult because, like preventive medicine, a lot of times we don't notice things until it gets to a certain boiling point where, why should I worry about my blood pressure? I don't feel it until someone gets a massive stroke. And then obviously something has happened. Whereas when you educate people, they're like, okay, nice. But then the partisan lens comes back on. You see it as, hey, it's them versus me. Why am I going to educate myself and think about this? And it's not until something catastrophic happens, they're like, oh, I can't afford this expensive hospital stay because I don't have good, like, affordable insurance, yada, yada. But because I voted on all these policies that go against my own interests, now it's too late. I can't do anything. Being someone who's potentially going to be in Congress, is there anything you can say about that as far as kind of, it's like talking to it sometimes like a wall of partisanship, kind of how do you cope with that mentally? How do you kind of approach that as Congress, where that's part of your job, obviously. That's what you're saying. Your biggest thing is educational, but what is it like just talking to a wall sometimes?
Well, you think about the fact that like 41% of Americans currently have medical debt, right? And most folks have medical debt that's under $500, but there are millions of Americans right now that have medical debt of $10,000 or more. So those are folks who already know that the healthcare system is broken, right? Everybody needs the provision of healthcare at one point in time of their life, whether it's a woman who is pregnant or who is giving birth or who has to make reproductive decisions, or if it's someone who's elderly and they're at another stage of their life where parts of their body are starting to break down, musculoskeletal or visceral, or if it's somebody who's a kid and their parents are taking them to get vaccines, taking them to get sports physicals. Everybody interacts with a healthcare provider in some way, shape, or form if they have the privilege of the coverage, right? So everybody has their own individual healthcare story. And that is not really a partisan problem. I think where it becomes partisan is you got to look at where the money is coming from, right? When there's trillions of dollars sloshing around in the system, all of those big players, the healthcare industries, the pharmaceutical industries, the insurance industries, the huge, corporate hospitals and purveyors of care, they're all fighting for their own stake in that industry, fighting to keep those resources that they've acquired. And one of the ways that they do that is they lobby politicians. Now, they happen to lobby politicians on both sides of the aisle. So that also is not quite as partisan. I think when you're trying to educate the public, it really in no small measure comes down to making people accept the fact that as a society, we have a responsibility to look out for one another. It's not just the right thing to do, but it's also the cheaper thing to do. When people come at me about being a socialist or that socialist, if you really want to provide everybody with affordable access to care, why should I pay for someone else to have health care? And you just have to explain to them, they used to say that about firefighters, right? They used to say that it was socialist to have a public firefighting company. There used to be private firefighting companies in the United States, right? And if you didn't have a private firefighting company, if you hadn't paid them in advance when your house caught on fire, especially you think about the cities earlier in our history where most of the buildings were wood, if your house caught on fire, the firefighters would drive right past it and they would watch your house burn down. But people started to recognize that fires don't stay where you put them. So my neighbor may not have, fire insurance, but if the firefighters don't come and put their house out when it's on fire, now it's spread to my house. And now my house is on fire. And it's the same thing with healthcare. We have healthcare outcomes that are individual outcomes, but there are also community-based outcomes. If everybody has some of that preventative and regular maintenance care is cheaper for everybody. One thing that we should have learned from COVID, you talk about partisanship, right, is that if your neighbor is sick, they have a higher propensity to get you sick. If you and your neighbor are sick, then the hospital is filled up and the emergency room is filled up if your other neighbor has a car accident, even though they're well. So we're all in this together. It's a closed ecosystem in American healthcare. And getting folks to understand that you may not have Medicaid, but when folks in DC cut Medicaid, it makes it more expensive for hospitals to function because they get 25% of their revenue from Medicaid. So they're forced to either decrease services, close down, or deny coverage, or raise the price of other coverage. So that puts all of us in the position we're in the same boat. I may not have Medicaid, but if they cut someone else's Medicaid, they are negatively impacting my health care. And I think getting that point across to people kind of goes across those partisan lines, where Republicans, independents, and Democrats all agree that they want healthcare that's cheap and affordable and accessible. They want it to be there when they need it the most.
Yeah, I'm going to give you this opportunity to do a little bit of education. We've mentioned kind of this public option several times. People might be confused on what that means. Like you said, they might think it's socialism, Medicare for all, yada, yada. What does it actually mean? And you mentioned this in the scope and kind of in the context of a competitive market. What does it actually mean to have a decent public option in the landscape of a competitive market? What does that physically look like? And this is your opportunity to educate the listeners on kind of what that looks like. And we'll definitely clip this and put this on social media.
So a public option for healthcare really is the provision of healthcare through a government resource, right? So instead of an insurance company that's going to be providing that care, there would be a government entity that's providing it. Instead of individual employers or employees paying into the system for the provision of that care, it would come out of a payroll tax or come out of a tax similar to what we pay into Medicare or what we pay into Social Security. Then that care is actually dictated and dispersed by a government entity. Now, I like that idea, okay? And I think that because it becomes, the word that scares everyone is it becomes mandatory, right? But all taxes are mandatory. So because it's spread across a large range of people who are healthy, some who are sick, some who are young, some who are old, you actually have the ability to keep costs low because you have quite a few folks who are paying into that system, but who don't need it yet because they're not in a position where they've had some kind of catastrophic accident. They're not old enough where they have all the comorbidities that may or may not require them to go see a doctor. And they haven't, kind of drawn that congenital short straw where they were born with or have some kind of serious medical problems when they're young. So by keeping the pool of folks who are healthy large, you keep costs down. Unfortunately, one of the things that happens when you have cuts to health insurance, especially, or cuts to programs like Medicaid, is that when hospitals don't get that money from Medicaid, they have to look at other ways to get it. So they wind up charging more to private insurance companies who in turn pass that cost on to us by increasing the cost of employer-based options. You see that closed ecosystem happen constantly where because it's small, as it gets closed off, the only thing that folks who are trying to get paid for the provision of healthcare can do is squeeze more money out of the people who are remaining that have money. By spreading that cost out amongst the largest number of people that you can, you keep all of the costs down and keep all of the costs low. Now, I love that idea, and I love the idea of the federal government having a larger role in it, but you have to imagine let's say the current executive being in charge of all of Americans' healthcare. That would, shake quite a few people and disturb their faith in the system. So I also like having the backstop of folks who have private insurance or employer-based insurance that they can buy into as well.
Yeah, that's a pretty succinct explanation there. And for those who kind of want to understand a little bit more about so many of the players and incentives, I actually recorded a whole podcast on that. It's about 50 minutes. It's a deep dive on things. So go listen to that if you're a little bit confused. You might come into that podcast, honestly, a little bit more confused. I know it was a bear to record that one, but there's just so many players out there. But the thing I want to drive home from what you said there is that at the end of the day, the cost always ends up getting passed on to us, to the patients in one way or another. We all think we're covered, but it ends up coming down to our employers now paying more, which means our premium goes up, whatever it is. And I'm even seeing kind of on social media and whatnot, a ton of very wealthy people that don't even do insurance because it's not really they don't care. They can just pay cash whenever they're doing it. And what really ends up happening is those people drop out of the pool for insurance, and it just ends up being people who make some money, a decent amount of money, but are not super wealthy. Their premiums keep going up. Next thing you know, no one really has good coverage. So there's a lot to unpack there. Excellent explanation there. I want to ask you, kind of shifting from kind of the national big level down to community programs. And I know I didn't put this in the outline, so sorry for that in advance. Obviously, congressmen have kind of responsibilities within their own community as well. Can you speak to the importance of kind of community programs when it comes to healthcare and kind of health outcomes?
Oh, for sure. I mean, especially when you're thinking about special populations and populations that have special needs. There is an organization called ECHO here in Tampa Bay that really deals with the provision of nutritious food to folks who ordinarily can't get it, people who are homeless, who are in between, a suitable housing, people who are in food deserts and they can't get nutritious food. ECHO is able to provide those folks with food, and they basically can go into a food pantry and then get nutritious food for themselves and for their families up to once a week. The federal government can't take care of everything. The municipal government can't take everything for different reasons. Folks in the federal government often don't understand the problems on the ground as much as do, and then local folks don't have the resources to be able to provide for all the needs of the people. So, nonprofits, other organizations, community-based organizations, faith-based organizations, they really are on the ground and they have that grassroots connection. So they understand the need and they can fill the gaps to buttress what local, state, and federal government can't do. That could be something as simple as making sure that women get prenatal visits, driving them to and from the doctor, helping them to pay for medication, sending them reminders when they need to follow up with an appointment. We see programs like that throughout the state of Florida because the maternal health outcomes are sometimes so poor depending on the neighborhoods that you're in. Programs like I mentioned, like ECHO, we think about preventative healthcare being only the provision of like family medicine and internal medicine visits and medication. You mentioned high blood pressure, right? The silent killer, but things as simple as getting a nutritious meal, right? If people don't have the ability to get food, they're not going to be healthy. Their bodies are going to deteriorate. They're not going to heal. That's why school lunch programs and school breakfast programs, which are often provided, if not by the municipal government or the county government, buttressed by community organizations, church organizations.
Yeah, and then kind of coming from that national to the local level, obviously there's a bunch of ways that local communities, organizations, and things can help provide funds for that. But this is something I don't actually know. Is there kind of a fund from the national government to provide some sort of programs down at the lower level that can be used by organizations? So something like getting grants and funds for kind of these local organizations. And then what does that look like politically? Is that something that is political, of getting these funds for, let's say, unfortunately, women's healthcare has become one that's partisan, but things like food deserts and whatnot, what does that look like politically?
You can always earmark funds for a specific need, not maybe a specific region, a county, but you can always earmark it for a specific need and then pass it on to organizations that are going to be able to disperse the funds to make sure that community organizations get it. So to be honest, that's one thing as a congressperson that I look forward to being able to do, right? So bringing funds back to the people of my district so that we can provide not just government services, but that some of those other organizations that are closer to the ground can get grants so that they can actually provide services to make sure that people don't fall through the cracks. Now, of course, that's political. As soon as you mention funds, there's some political inertia to that, right? Whenever you're talking about money, it's, people look at the pie as a finite object and everybody wants to get their slice. So you do have to make compromises with other programs, with other Congress people, other states, et cetera. But I think making sure that you can provide for your district should be the number one goal of every congressperson.
Definitely. And one of the things that politically you've kind of mentioned a couple of places is that you want to do things evidence-based, and that's what you kind of bring into Congress. And I'd say as far as the evidence goes, preventive medicine starts at the community level. There's so many things as far as social determinants of health that the evidence has shown that kind of improves whole bunches of outcomes. And
Mhm.
everything that you've talked about as far as a lot of these programs and funds that you'll be bringing back to the community are definitely part of those social determinants of health. Can you talk a little bit about kind of the importance of those and kind of what's that like in your specific community? And then we can kind of extrapolate that larger on.
120%. Unfortunately, here in Florida, we have seen a tremendous backslide in, evidence-based provision of community medicine in general, right? So our Surgeon General here has advocated for some things that are in no way, shape, or form evidence-based. And to be honest, my humble opinion, completely ridiculous. He said that he thinks it's okay for folks to drink unpasteurized milk if they know the history of the cow, they know where the cow has lived or where he's come from. I mean, that's insane. Okay, we pasteurize milk for a reason, and there's no way that anybody can keep up with the history of an individual cow. Okay, here in the state of Florida, we've taken the fluoride out of water because it's become partisan whether or not we're forcing people to take this chemical into their bodies. The single most effective, cost effective, but also effective in terms of outcomes preventative measure that's been taken in basically medical history, right? Putting fluoride in water and being able to stop tooth decay, being able to stop the inflammation throughout your body that winds up leading to heart attacks in the future, right? We've decided here in the state of Florida that now that is somehow forcing people to take medication, so they've taken the fluoride out of water. It's made national news, the fact that we now in Florida no longer have vaccine mandates for children. So, we have tremendous tourism as a part of our economy here. We have kids coming from all over the world, kids coming from all over the country to come to our theme parks, beaches, food, our culture, and of course our own kids are not forced to be vaccinated because forcing them to get vaccinated in order to go to school is deemed to be bad for the parents and taking away parental rights. So our kids are going to be exposed to diseases from all around the world. And we already we're at the 95% that would be considered full immunity for a community. We're already closer to 93, 92. And without those mandates for kids to get vaccinated before they go to school, we're going to dip down to 89. So those decisions at a state level are definitely going to have impacts here in the state of Florida. I mean, we're going to see measles outbreaks. It's only a question of when and how bad it's going to be, not a question of if it'll happen, because we're below the threshold that would be required to stop an outbreak from flaring up. We're not going to see the effects of taking the fluoride out of water just yet because it takes a little bit of time for teeth to decay, but eventually we will see that as well. And once again, these are preventative measures that have an impact on an individual's health. Okay, and individual health is important. You and I both know that as physicians. But from a population perspective, it drives up the cost of healthcare for everyone, which makes healthcare less affordable and less accessible for all of us.
Dr. McAuley, you have your work cut out for you. There's a lot to do. There's a lot of things going on, especially in your state, as you just mentioned. One of the quotes that got me excited, and I'm probably butchering this quote. One of the quotes that got me excited to have you on the show, I think it was in a Politico article, was something about the fact that you're saying politicians will wag their finger kind of in the air and kind of go wherever the wind is blowing as far as what's in their favor, whereas physicians should be evidence-based and kind of follow some sort of guiding light of what is right, what is true, what's scientifically based. So I'm excited to see kind of how your run goes, and I'll be following along on the Instagram page. As we're starting to wrap things up here, the classic question that we always ask everyone when we start to close out the show is, in 2 minutes, if you had to catch someone or someone caught you and asked you, hey, you're the famous Dr. McAuley, right? What do you tell them about how to get healthy?
Well, I would tell them to listen to your body. I would tell them that if you feel like you're sick, you likely are. I would tell them to take care of themselves and take care of the people around you. If you have a supportive system of friends and family, if you're getting an adequate amount of sleep, if you're trying to get nutritious meals, if you have a good relationship with your doctor and you trust him or her, you trust his or her advice, and if you stay away from things that you know are toxins, you're much more likely to have a better outcome.
For our listeners back home, that sounds like the 5 pillars of preventive medicine to me for the most part. So it's not something I made up. It's something that's kind of out there that a lot of physicians do know and we do talk about with our patients. And Dr. McAuley, I don't think I ever actually formally thanked you for your service as well. So number one, thank you for your service. And then thank you for coming on this podcast and for all the excellent information and kind of education that you put on here.
Thank you, my pleasure. Thank you for your support. When folks say thank you for your service, I sometimes feel bad because it's been a phenomenal job. I have enjoyed being in the Air National Guard for the last 26 years. I enjoyed working at the Veterans Health Administration. And the passion of my life is being an osteopathic physician. And like Still said, reminding us that we need to be finding health and not disease.
Definitely. And outside of that Instagram page or anything, is there any way that our followers can go and support your campaign or anything like that? And this is, I'm not necessarily endorsing anyone on this podcast, but if people do find this and they do want to kind of help you out, where can they do that?
If they go to darrenforflorida.com, DARRENFOR, Florida.com, they can find out more about my platform, more about me as a person, and of course, they can join the coalition to help us win.
Perfect. Thanks so much.